Patty Clapper.
Hi, everybody.
Hi, Ann.
How are you?
Tori, good morning. You got a haircut. Good morning, Tori. You got a hair bob.
He got hair, yeah, got hair in his ears.
Let's see. I think I have quorum. 1, 3, 4. I've got 5. Jordana, that is quorum 5.
4 is.
Okay. Well, good morning, all. I want to thank everybody for joining us this morning. And firstly, I do want to apologize for not being able to join you last Thursday. My orthopedic appointment was supposed to only be a half hour, sat in the office for well over 2 hours over at this Stedman clinic. So just so you know, my shoulder is fine. And I'm just getting excited about the holidays and want to wish everyone a wonderful holiday. And with that said, I'm going to go ahead and call the meeting to order. We do have quorum. I would ask, do I have a motion to approve the agenda as stated?
So moved.
Thank you. Do I have a second?
Second.
Thank you. All in support, raise your right hand. Okay. Well, this morning, we got to do the minutes. Do I have a motion for approval of the recent meeting minutes from last week? Thank you to Dr. Kurt. Do I have a second?
Second.
Thank you, Greg. All in support. I will not be voting because I did not attend the meeting. Okay, that does look like quorum. Thank you very much. That was unanimous for those who attended. This morning, Jordana is going to give us a presentation, and so will John. I know that everyone received the note from Jordana yesterday. She and I and John met on Saturday by Zoom and had a lengthy conversation about concern that we have relative to the increasing amount of our incidence rate, which is pretty appalling. So I'm going to turn it over to you, Jordana, and just want to remind the board, our duty is to focus on public safety and the health and welfare of the community and all of our constituents here in Pitkin County. That is first and foremost that we need to keep in front of us today. I'm very, very concerned, and I know that my concern is shared by many, many that are on this call. So, Jordana, I'm going to go ahead and turn it over to you.
Thanks, Marky. Thank you, Board of Health, for coming together on such short notice. If we can share the slides here, advance couple. We'll start by sharing the data that was shared with the Board of Health over the weekend and is always shared in these daily reports. Friday, we ended up having 58 cases reported to the public health department that we then needed to assign out and do contact tracing and case investigation. Our incidence rate, as you can see in this graph, is increasing exponentially. You know, if you look back just to December 6th, we were under 1,000, and as of today, we are, you know, this is the last report that came out, but we are over 1,400 with our current incidence rate. You know, this means that almost 50% of cases that we have ever had in Pitkin County have come in and been reported in the past month, and 28% of all cases that we have ever been reported to Pitkin County since March have come in the past 2 weeks. So we are, the rate of cases that are being transmitted in the community is spreading at an exponential rate. And we do think that this is a concern that we need to discuss today. Looking at the next slide, just shows those case counts and how they continue to grow. All of the counts all of the cases that come in, when we get this many, we are not able to perform the box it in strategy effectively. We're not able to contact everyone who has a positive case in what we were doing before, which was 24 hours. Now it's much later, and we've had to decrease the length of time and the questions we're able to ask in the interview, which just continues to decrease our ability to notify everyone who may be exposed, and continues to contribute to increased rates of transmission. And that's just a function of the numbers being so high and spreading so rapidly. If we look at the next slide, this again is the dial level. We are still in orange, although our incidence rate is well up over 1,400. Our 2-week average positivity is still in the yellow, is pretty low because we do have a lot of testing going on. And we have not yet seen that metric flip to around hospitalizations be triggered. We have not yet had 3 Pickens County residents become inpatients on the same day. But I think when we're having these conversations today, I really want the board to be thinking about what this high of an incidence rate means. It means that a lot of people are getting COVID. A lot of people are having to isolate. Everyone they've been in contact with is now required to quarantine. We're going to see, a lot of businesses that are going to be affected by this and not be able to operate. And a lot of people who are going to get sick, maybe sick enough to be hospitalized, maybe just sick enough that they're going to have, have to be sick with COVID and then deal with some of those resulting brain fog or issues that are coming down the line that we're still not totally, we don't know all of the impacts, but we know that they are lasting beyond sometimes that initial infection. If we go to the next slide, again, we saw this last Thursday. And at this point, Dave, I'm going to turn this over to you because I think hearing from our hospital about, the capacity restrictions that they're facing, again, it's because there are so many of their staff that are out due to either having COVID themselves or having to quarantine because they've come into contact with someone. So Dave, I'll turn it over to you.
Yeah, thank you, Jordana. And you expressed it perfectly. The hospital, while we are not yet seeing a surge in a number of patients being admitted and haven't triggered that part of the dial that Jordana just explained. And as you can see on our own matrix, we're still comfortable with regard to the number of people presenting here in our emergency department or for admission. Our biggest challenge right now is that we do have a significant number of our staff and physicians that are either out with illness themselves or that are out with quarantine. And the most significant driver of both of those is the community spread. So we're keeping our employees and patients and physicians safe as here at AVH with all of our preventive measures, such as screening and testing patients that are undergoing procedures, et cetera. We can't keep our employees safe when they're out in the community. And so we're simply experiencing the same dynamics of significant community spread at AVH. So I'm happy to answer any questions. Oh, I will say this, that it is the opinion of our medical staff, our chief of staff, Dr. Bernard, that the reason we're potentially not experiencing the surge in admissions yet is that we have some sense that our most vulnerable in the community are following the rules and keeping themselves safe. Those that would otherwise require admission or additional treatment for more severe conditions if they're at risk because of their age or comorbid conditions like chronic conditions. So perhaps that's some good news in all of this, is that our most vulnerable are keeping themselves safe. But beyond that, we anticipate that we ultimately will be impacted by the spread of the virus. And I just got some updated information. The Valley View right now down Valley does have COVID patients. They do have capacity and yet remaining, and same with St. Mary's Hospital. So we are at this point in time do have options if we have somebody that needs to be on a ventilator and would need to be transported. But again, we're watching that literally on a daily basis because it's highly subject to change. So I'll answer any questions if you have them, but that's our update.
Dave, how about their staffing levels? I understand that's a problem, and thank you for articulating it's a problem there at AVH with so many staff either in quarantine or out with some type of illness. Are they seeing the same issue down at Valley View?
They are. I don't have, we don't get staffing levels in the reporting that we do on a daily basis, Marky, so I can't comment specifically. I just know it's been an issue, an ongoing issue for Valley View. And I do have an update as we've been talking that actually St. Mary's at this time does not have an open critical care bed. So we would have to look to Denver if we did have somebody that presented that we needed to transfer, which isn't the case right now. But if we did, we would have to look to Denver for an available bed. So it's safe to say, Marky, that exactly to your point, all of the hospitals in Colorado have the combined impacts of increased incidence among our own staff and physicians and reducing our staffing capacity as a result, as well as increased numbers of patients. I think Jordana will explain that around the state, there has been improvement in the overall incidence rate. So hopefully that will take some pressure off of the Denver facilities that we would need to refer to at this point.
Okay, Greg, I see you have your hand up as well.
Great, thanks. Just a question for Dave. You know, I think it's hard for us to understand what the medical staff in the various hospitals are actually going through. We see pictures every now and then on the internet, social media, of exhausted medical staff. And I guess what I'd really love to hear is just how, I know we're getting spread thin, but are the people we have at the end of their ropes with exhaustion? Or, you know, how can we get some information out to the community about what our frontline people are going through? Because I think that might help drive the seriousness home to the community.
And that's a great question, Greg, and a great observation. Yeah, and I think there has been quite a bit of media coverage. I'm sure if we were to ask St. Mary's Hospital right now, that is completely taxed. What their medical staff is going through, you would hear absolutely those stories of exhaustion and frustration with the number of cases they're experiencing. And similarly, Valley View, I know last week we had open discussions among members of our medical staff about what they're experiencing at Valley View, and they are completely taxed right now. So they are feeling the combined impacts of the people being out and a number of COVID patients presenting. Again, that was a topic of discussion for a number of us. It's somewhat paradoxical right now that AVH isn't. And I don't really, other than some comments I offered a minute ago about hopefully protecting our most vulnerable population, have any other explanation for why we're not experiencing those same issues, but we're not complaining. We just can't allow it to lull us or our community into a false sense of security. It does not mean that this virus isn't dangerous and that we should not be focused on the containment efforts that you're going to be discussing this morning. That is absolutely the case. These containment efforts are essential. And so we're pleased right now to not be under the same stress that you just illustrated, Greg, with other hospitals that are around us, but let's not take it for granted.
I'd like to comment.
Dr. Kurt, go ahead.
I noticed that Dave commented that perhaps the population is younger. And as a senior citizen, I know senior citizens are being more compliant with the rules. So I would ask Jordana, are the positives or the proportion of positives now younger, and the younger people don't necessarily need to be hospitalized? And does that explain this?
I'm not sure if we've got, Josh, if you have that data at your fingertips, I'll give you a minute to unmute there. I think the other thing that we know are a lot of our essential workers who are out there and in the fields and being exposed to a lot of this community spread are oftentimes not residents of Pitkin County. So thinking about, also what we're seeing in Garfield County and Eagle County affects us as well. Josh, I'll turn it over to you.
Yeah, sorry, I couldn't find my unmute button. So 40% of our recent cases in the last 2 weeks are 51 years old and older. And that's pretty similar to what we've seen throughout the pandemic. So while cases have been slightly younger recently on average, it's not that much different from what we've seen throughout the entire pandemic.
Okay, other questions for Dave? Yes, Dee, go ahead.
Yes, and the comment. The comment is I've heard from physician colleagues at Valley View, and they are so overrun that they are sending sick patients home with dexamethasone and blood thinners at home. And that is just terrible that they cannot manage them in-house. But I do have a question for Dave. I just would like him to talk about the ICU capacity. I noticed on Andrew's, the charts he sends out that there are no ICU beds available at this point. Could you comment on that?
Yeah, I have to apologize for that. I haven't seen the specific chart from Andrew that you're referencing, but I understand that over the weekend, we had a reporting error with the online system called EM Resource, and a staff member inverted the information and meant to indicate that we don't have any ICU beds in use, and instead indicated that we don't have any ICU beds available. So we caught the error this morning and corrected it and notified the state, but not before that misinformation had been sent out. So we, at this time, do have ICU beds available. We have 4. All of those are negative pressure. And we do communicate on a daily basis with Valley View, Vale, Rifle, our immediately surrounding hospitals, as well as our statewide briefings. And we also have another briefing for the Western Slope to compare bed availability. And we work together if it's an opportunity to be able to send patients to where they can best be accommodated.
All right, if there aren't.
Okay, I had to let my dog out. Okay, Jordana.
Okay. The next slide will show, again, this concept of the orange level versus the red. So, the counties who were in that orange or even orange plus have seen, mostly growth or plateaus with some exceptions. Back in November, this was our decision to go into orange and to see if we could bend that incidence rate curve back down with some additional measures, but not the most extreme measures of what we see in the red level. I think that it was successful in Eagle County. They made a very similar decision. They stayed in orange. Their incidence rate is down to 800. Ours is almost double that. And so, I think what we are seeing is that our orange plus has not worked to bend that incidence rate back down, and we continue to increase at this exponential rate that is extremely concerning. The next slide just shows some of the success of that red level and about how long it took for some of these counties going into red before they did see that sustained decrease. I think just to show that red level, although restrictive, is effective. So if we go to the next slide, it really brings us to what we need to discuss today. And I wanted to leave the majority of time today open for this really important discussion to happen. So the recommendation is that these additional protective measures are needed to decrease the rate of COVID-19, the incidence rate in the community. I also just have information back from the state that follows up on the request that was made at our last Board of Health on Thursday. We've gotten feedback that the state is not supportive of us revoking that curfew or what they see as our mitigation measures, and actually would be supportive of us implementing even stronger mitigation measures right now because of our concerning incidence rate that has really just changed from the last time we met to today. And the concern is that it will continue to increase without additional measures.
Jordana, it may be worth, just because we have so many people on the phone with an interest in that the email is pretty short, it might be worth just reading the email that was sent, and that a letter will be coming.
Sure. So the email states, "Dear Interim Director Sabella and Manager Peacock, thank you for your letter on Friday requesting to remove the county's curfew from your mitigation plan. I will respond to your letter more formally, but wanted to let you know that I have reviewed your increasing incidence rates and do have concerns about them. I recommend that Pickens County put in additional mitigation restrictions and not less. I'm happy to have additional conversations at your convenience. My best, Jill." And that's from Jill Hunsaker Ryan, the Executive Director of CDPHE.
Jordana or John, can we talk about those additional protective measures that could be under consideration for discussion?
Thanks, Marky. If we go to the next slide, it'll give us an outline of those more restrictive measures that we see in the red level. So at the top, there's an 8 p.m. last call. Personal gathering size is limited to 0. So essentially, you are directed to only be gathering with your household members. The restaurant measures here, so indoor in the level red, dining is closed indoors. Takeout, curbside delivery, or to-go outdoors, to-go orders are permitted. Outdoor dining would be permitted, but only with groups of a person's own household. Other major changes in this level red on the dial are that offices are reduced to 10% capacity, remote work being strongly encouraged. Personal services are at a 25% capacity. Gyms and fitness centers are down to that 10% capacity. Indoor events and entertainment, again, indoors they are closed, and outdoor events are permitted. And again, you see the emphasis on only being able to be seated with members of your own household, and continuing to have spacing between groups. So those, the level red are some of these next level of restrictions that we have seen become, it is what's been successful in some of these other counties being able to decrease their incidence rate and decrease community spread.
Questions for Jordana or John? Yes, Tom?
I know we're not counting Garfield, Mesa, and Eagle counties in our numbers. Are we counting the tourists in our numbers and considering the tourists have probably doubled in the last couple of weeks?
Tom, so the only, our incidence rate's calculated by residents. And so we count a resident as someone who has been here for 30 days or longer. And that's our numerator, and our denominator is the census tract.
So how much in the separate positives are tourists adding to numbers? Do you keep track of that?
Yeah, Dr. Kurt, right now, about 9% of all cases reported to us have been for people that don't live here in Pickens County, which is a lot lower than it has been. So we have not seen an uptick in cases among tourists at this point.
Well, thank you. Perhaps the traveler's affidavit has caused the lower rate, and we should take some credit for at least that portion of prevention.
Okay. Jordana, just thinking about Eagle County, I know that they did a combination of a variety of things. What did you glean from what they've done?
So I don't have a breakdown, Marky, right in front of me of the measures that they took because they did remain in orange there. I'll see if Larissa's on the line. Larissa, if you're able to pull that up while we're talking, and then let us know if you have that information, when you have that information. That would be helpful. And I think they managed to stay, as you said, Marky, they managed to stay in orange. And I think this is also something that we are seeing, alignment in the Roaring Fork Valley, right? With our incidence rate ticking up to align with Garfield.
Okay, Larissa.
It might take her a minute to go digging for that, Marky.
So
Yeah,
while
just
we're
give me,
waiting-
just give me a few minutes and I'll pull that up.
Okay, Larissa, thank you. I'm going to see if we have some questions from board members.
Jordana, I have a question about enforcement. I think the reason there's such an uptick in cases is people are still getting together. I'm still hearing rumors of New Year's Eve parties being planned with hundreds of people. And even if we go into red, how are you going to enforce this and stop people from spreading COVID?
Jeannie, I think that's a great question. We can continue to brainstorm here. I know we have had our law enforcement partners at the table who, when there have been egregious violations of the public health order, have been willing and able to step in and help break those up. We have done our duty to message this. We have put the event safety plan into place. We have worked with informing those that might be working parties of that nature, whether that's event planning staff or catering staff of the rules. And then to your point, sometimes we need to count on our community to be able to align there. So if there's any ideas on enforcement and what we can do, it's going to take the community to help help police ourselves as well. You know, we do have measures in the public health order to hold fines or jail time for those that are in violation of it. But, you know, by the time we do that, the spread has already happened. You know, we're really needing the community to pitch in and know what the measures that they take have immediate impacts.
You know, Jeannie, I was thinking about this whole thing with the parties because I'm well aware of some parties that would be happening in our community here. I think it would be we as the board and through our staff need to notify any catering company that is out of compliance, potential lifting their license to operate as a catering company. Now, that is a tough message. So, I mean, that's what we're talking about in terms of thinking through mitigation strategies. Those are the tough ones that we've got to make some decisions on. I'm not real excited about having a lot of indoor events. And I know there's quite a few planned, not only in Aspen and Snowmass that are indoor. So that's another example.
Marky?
Yep.
Along the lines of notifying catering companies, I've seen a lot of big party rental trucks coming down my street and going up to a couple of larger houses in the neighborhood. So that would be another group to contact about the events.
That's a great idea, Anne. Let's note that idea as well.
There was a truck that asked for directions and I refused to give them.
Hey, Marky, Greg here.
Yeah, go ahead. Love it.
I don't know if that was me or I think Brent may be trying to speak also. Tom Kurt had a letter to us all earlier this morning regarding having deputized compliance officers who actually go out and do the work that needs to be done regarding enforcement and laying down the law. I think maybe we need to talk about this. Dr. Kurt wrote a letter to us to that effect, and he may want to speak on it. I also would love to know just about what else can we say about the demographics of the spread as we see it now, and are we going to be able to cooperate now that our incidence rate is up higher? Maybe Eagle and Garfield will be asking us to cooperate with them. But I'm just thinking, you know, what do we have in the way of cooperation with the neighboring counties? Because clearly we all depend so much on each other as the workforce flows back and forth and as tourists flow through. So compliance officers and cooperation, I think, is going to be essential to get us through this. I'd love to hear what other people think.
And then Brent.
Yeah, I really do not support that idea of deputizing people to go out to chase down infractions. You know, our police officers and sheriff's officers have a large amount of training. The ACRA put together their ambassadors this summer, and they had a lot of training in how to handle any kind of controversy, any aggressive behavior, this type of thing. I have strong reservations about just deputizing anybody who kind of wants to come out and do compliance unless there's a full program of training.
Okay, so Ann, I wasn't suggesting we just pull people off the street, but it was a suggestion that we actually have people that are dedicated to doing that from whatever qualified background we can get.
Well, then you could reference what ACRA did this summer, because that's how they approached it.
Brent?
Yeah, I just want to say I hesitate on the deputizing part of it, but I do think that, I mean, obviously it rests on compliance, and that requires a public support and acquiescence. The higher level of compliance we can get, right, that's going to be the big secret. That's the problem throughout the country. We've had not the level of compliance that we would like. But I just want to say, you know, if the world's on fire here, and I submit that it is, you can ask any junior firefighter and he's going to tell you that the first thing you need to do is anticipate the fire. You don't fight fires retrospectively, and that's exactly, in my view, how most of us have reacted to this virus. We're looking backwards, and this thing runs 14 days ahead of us, plus with huge amounts of unanticipated symptoms, side effects of the virus that we didn't know in the beginning. So it gets progressively worse and progressively crazy. And not to use another metaphor, but you know, in the game of chess, if you're playing a deadly game of chess, or even if it isn't deadly, if your strategy is to defend, you lose. You simply must be aggressive at the appropriate time. And so I, just as a background here, say that, you know, we have to get ahead of this thing. And that means we have to do things that are a few steps forward as opposed to just reacting to the current situation. And right now, as far as I can tell, all these trends are getting worse. So.
John, and then
Mark,
we'll come
I would suggest we can come back to the enforcement piece, because I know there's still more staff had to talk about in terms of recommendations. I think this is the first of several slides on potential options for the Board of Health to consider on the policy side. And then we can talk about, we are working on building our consumer protection capacity, but I'm worried that we get mired down there and the board doesn't get to the policy discussion. So just offer that.
Thank you very much, John. Tori, and then we're going to loop back around to see if Larissa has been able to find the data. And if not, then we'll go back to that red slide and talk about each one of those interventions and determine to what extent we'd be supportive of the various concepts contained within that chart. Tori?
Thanks, Marky. I appreciate you saying that, because that's first, I just wanted to ask a point of clarification if the recommendation was the red level restrictions plus the 2 additional items, or if we were going to go through that as a listing and discuss different measures. So I think what I'm hearing is that we're actually going to be talking about some of the different opportunities that we have right now. I guess I just, at some point, I'd like to hear maybe the health team's take on some of the discussion that's been going on in the community surrounding private events, informal gatherings, and the assertion that allowing restaurants to continue to operate at this diminished capacity of 25% with additional restrictions on them, many people are putting forth that is a safer alternative, perhaps, than not having those controlled environments available for people, and thereby increasing other gatherings and such. And I just wanted to hear the health team's take on that. Is there any correlation, any numbers that have been seen, anything that we can hear on that side of the discussion?
Jordana?
I think, Tori, what we see is that red level as a whole works. That's what we've seen bring the incidence rates down in our other counties across Colorado. I don't think that we can know what kind of informal events and gatherings are happening. We have mobility data, which we know when counties go into the red, there's less travel. When counties go into the red, there's also this stronger messaging of saying this is a concern. We're in red. These things are really closing. We're concerned about people from different households being indoors together. And I would imagine that level in general brings a greater sense of caution to the public who may not understand the nuances of Orange ++, Orange Crush, one measure here and there. But I don't think that we have evidence, which we love to have in the public health world, and we're really working from just kind of these case studies and seeing on a whole what we know works. I think I think that really that probably needs to be the conversation, is that if we are to be able to bring down, if our goal is in protecting the health of the community and decreasing the number of people who are going to be transmitting COVID and catching COVID and dealing with those symptoms. I think that the conversation is going to need to be that red level is what's known to be able to have an impact there. The question is, is that a conversation that we want to think about doing now, understanding, these next 2 weeks are really the ones in our community where we've got folks here, restaurants and businesses make a lot of their years worth of earnings then. I think that we do need to take that into conversation, but I also think that the choice is probably going to come down to, do we want to support going into the red now or later? Later being in 2 weeks if we see whatever additional protective measures that we've put in making a difference or not. So maybe if we want to go to that red slide, we can work through some of those additional protective measures. And then I'd really be curious as to, the board's discussion on, what are we willing to say if we don't have that second indicator that pushes us into red, but we continue to see a skyrocketing incidence rate and we're not able to keep our schools open because kids are just having to get sent home and their whole cohorts and grades are sending home. Businesses are going to be impacted by this, by not being able to stay open because their workforce will be sick. What is this Board of Health's responsibility in saying we need to, as a community, take the measures that we know are going to bring down that incidence rate to ultimately get us back sooner to a level at which we can operate for the rest of the winter, as opposed to just watching that incidence rate tick up and see the impacts that it has on everyone.
Thank you.
Hey, Marky and Jordana, this is Kim. I don't know if you can hear me.
Yes, I can hear you, Kim.
Hi. Yeah, thanks. I just can jump on for a minute here. I'm actually driving to the emergency room for a shift right now, and we'll certainly be treating COVID patients. I just wanted to make a statement that that we really need to listen to public health right now. We all need to clamp down. We need to look at the data. There are rising rates in Pitkin County and leveling and going down in other counties. And the time is now. We need to control this. We all need to take personal responsibility. We know public health orders work, and this is a reality. And this is the time to be adults and be mature and go inward and do the right thing. And this is unfortunately the reality, and that's the statement I wanted to make. It's very hard to see this as a reality when you're out at a party. I would love to invite everybody into the emergency department and bring the reality into everybody's homes right now. This is true, this is happening. It's hard to see if you're not directly impacted by it or you're not seeing it. But unfortunately, we are in a high risk resort town where we have incoming visitors who may not care or pay attention as much as we have been doing all along. And we all need to work together now, our visitors, our residents, the Board of Health. And I just wanted to make that statement. Thank you.
Thank you, Kim. Okay, did Larissa find that document? If not, we're gonna.
Yeah, yes, Marky. So as Jordana stated, they did stay in the orange level and they added some additional protective measures, which really include things that we're already doing. Some additional measures for requiring visitors to be symptom-free before arriving, some additional requirements for businesses. Face coverings were made more restrictive to what we actually currently require, which is masks being required to be worn except when actively eating or drinking. So that was also added, requiring businesses, any business that takes a reservation, to ensure that they understand the local requirements, such as the 5 commitments of containment. And then they also implemented something similar to our event safety plan form, as well as a version of a business safety plan, specifically focused on what they call a social distancing protocol.
Well, we've done all those things, so guess
Yes.
what? We've done all those things. It's not working. So let's pull back up that red level slide and go through each one of these at a time. Let me pull that screen back up. Okay. Oh. And Jordana, how about we go through each one of these, unless I have someone within the board that would like to make a motion to say, let's go all red. And I'll look to see.
I have a comment, please.
Yes, Tom, I'm sorry, I didn't see your hand.
I'd like to go all red except for the restaurants, which I think are suffering terribly now, particularly going into this Christmas week. And what the further restrictions on the restaurants is just going to drive the catering into the social groups where more cases will occur there. So I'm in favor of all of the red except for restaurants, or adopting the 5-star program early on our own. Not waiting the 2 weeks, but doing the 5-star early on our own.
Well, I don't know if the state would approve us doing a 5-star program. That's what I learned over the last 2 to 3 weeks until we get our rates down.
And Marky, I can follow up on that suggestion made by Dr. Kurt. If we advance 2 slides, you know, Dr. Kurt, I think what you're suggesting is we can stay in the orange level and adopt these more restrictive measures that are in red, which still allows us more control. If we wanted to really think about, especially in this near term holiday time where we know the restaurants need to make a lot of their income for the whole year, we could consider the restrictions that those counties who have gone into red are now seeing decreasing incidence rates and are having their businesses get certified in the 5-star program. A lot of those counties are, when they're still in the high incidence rate in the red levels, this is the way that their restaurants are being able to operate, where they're requiring additional table and household distancing. So table distancing is required to be 10 feet between parties in that 5-star program. And then also the only people from the same household may sit together at the same table. So what this is trying to address is, you know, the fact that if we're adopting those red level restrictions of saying, you know, only one household should be interacting with itself, that household can still go out and support the restaurants, and by being more distance from other folks within the same setting, that is seen to be a safer option than all of the mixing of different households at one table that's currently occurring.
Okay, thank you, Jordana. Let's talk about this one component of the 5-star program. To me, this one does make some sense, but I'm going to let Patty, I think I see your hand up.
Yeah, I have a hand up. You know, we talked about this at not the last meeting, the one before, and Tom Kurt had a really good point. Our restaurant facilities are small. If we go to 10 feet, I'm not sure that it's going to be worth it for them to stay open. I know there's a discrepancy. Is it 5 feet? Is it 50 feet apart? But I think 10 feet in most of these places, they'll have 1 or 2 tables and they're not going to operate under that. So I think we need to take that into consideration when the board votes on this. And I think enforcement of same household is going to be very difficult. People can say, what do you have to do? Have a birth certificate to show that you're seated with your mom? So I think we need to look at that, you know, with a more common sense point of view. That's going to be really hard for enforcement. The other thing is, and I would encourage every restaurant, whether you're taking reservations or not, to keep a list of guests with contact numbers. A lot of restaurants are doing that anyway. I think it's a great idea. It's not that tough to do. And then for contact tracing reasons, it makes life a lot more simple for those folks that are out there trying to track people down. And I think we might not be able to require it, or maybe we could, but I think keeping a list when people come in would be great.
Patty, we already require that under our current public health order.
Well, I heard some statement in here that it was when you have reservations, and a lot of restaurants in town think it's only if you're taking reservations do you have to keep a list. So we need to clarify that. Thank you, Jordana.
Okay. Brent?
Yeah, first off, I agree with Tom. I think maybe I would certainly listen to a compromise relative to the restaurants, at least a partial one, and maybe that's that 5-star kind of requirement. The same household thing, to Patty's point, all of Los Angeles, in fact, I think maybe it's all of California, is under that restriction. And you're right. You're right. It's difficult. Nobody's going to have a family passport to show who's in the family, but it goes again to public acceptance. And at least we do what we can do. If the public wants to be more liberal than that, you know, we really can't. We have to accept that reality. But to Marky's idea of, or suggestion regarding the caterers and so forth, you know, it seems to me totally fair that we do place responsibility on caterers and food servers and all the rest, that they can't knowingly, I say knowingly, participate in an illegal activity. So, you know, they ought to be able to simply not be able to function if, well, actually, sadly, I don't see how they can function with any group size, right? That activity is almost completely prohibited by the fact of the limiting of the gathering size. So, in any case, that's my
Yeah, Brent, you raise a very important point. When I talked about the catering just briefly, my goal was how can we box it in with these informal gatherings? And one strategy was the catering industry, and the other strategy was informal or events, and the other strategy was to do the red level on the restaurants and do 10 feet. 10 feet is far better than 6 feet and limited to one family. You can find out when you take the reservation. Question is this one family? And most people are pretty honest. I mean, we're never going to catch everybody, but we've got to figure out how to box this baby in.
And I think we need to, I mean, not that we don't, I don't mean to be preaching, but I mean, this is war, right? This is extraordinary times. If we were having discussions like this for something lesser, you'd hear all sorts of people talking about infringement of their personal rights and et cetera, and, you know, recording data on an app and this, that, and the other. This has shown us what we have to do to fight an enemy like this, and it only gets worse. So if we're going to err, sadly, I think we have to err on the side of conservatism and with strengthening curfews and keeping distances as much as we can. And this isn't forever. And I think if we look backwards, we would say, at least I think, that this was not done properly. And this is throughout the country. What we should have done is gotten more serious earlier, and we wouldn't probably be having quite this conversation. And now we're down to, as you know, has been said on CNN and everybody else, we're now down to waiting for a vaccine. We've given up all our other strategies. There are none left. Even tracing is somewhat worthless, I believe, at this point with community spread virus. So all we can do is mask and stay distant, really. Avoid everybody else, mask up and wait for the vaccine. And it seems to me any steps that we can take towards that end are the proper ones.
Thank you, Brent. Other comments?
Marky, I just want to remind the board that this is exponential growth. A few weeks ago, we were seeing maybe 10 new cases a day, and now we're seeing over 50. And it is very important to stop this right now, because next week we could have 100 new cases a day. So I'm in support of, I know that it's hard for restaurants to make a profit, And I encourage the community to get takeout and leave big tips. That's what I do, because I think it's the safest way to stay safe, keep your relatives safe, and to keep the restaurants in business.
Are you
So-
suggesting, Jeannie, just to clarify what you're saying, and hopefully I heard you correctly. So are you strongly encouraging or recommending or want to do a motion to go all red?
It's a very difficult decision, but I feel at this point that we really need to stop this virus. We have lost the marshmallow test. We failed it in our community, and we really have to stop it now before it is truly out of control. And hopefully, if we get through this, the restaurants can open up some more. But I think with exponential growth, we could have 100 new cases every day next week, and the following week, 200 new cases. And then we'll be looking back at this time and hoping that we had gone into the red. And I'm hearing a lot of this from our community as well.
Marky?
Well, just a minute. Okay, so is that a motion, Jeannie?
That's a motion, and I'm happy to talk about it some more.
Okay, go ahead, Jeannie.
I just think we're in a terrible situation right now. I'm hearing from healthcare workers who are very concerned, very exhausted. I'm hearing from the schools. I've been very involved with school testing. At this point, with 1,400 per 100K, we're not going to be able to get our kids back in school in January. The governor set a threshold of 500 cases per 100K for full in-person, and we are almost 3 times that number. And it's really important to get our kids back in school. We've seen a terrible COVID slide. The kids are not doing well academically. They're having mental health issues. It is a really dire situation. And we have to think about our children.
Okay, thank you very much, Jeannie. And we have a motion on the floor. Do I have a second? I'm looking at board members. Anyone want to second that motion? To go red?
Marky, this is Suzuho. Sorry to interrupt with some technical pieces, but I think we need to finish out Dr. Kurt's first motion and either get a second or take that off the table before we can push out a new first motion.
Tom, was your, the 5-star, was that a motion for clarification?
No, I was suggesting in a motion that we adopt the red except for restaurants. And to try to be in compliance with that, take some of the components of the 5-star program that apply to restaurants and thereby make the restaurants a little bit more compliant. Because if we remove if we create these such restrictions in restaurants, as Patty well pointed out, there are not many Aspen restaurants that can accommodate tables 10 feet apart. Our restaurants are small. And we're just going to drive those people into the small social groups, which we've shown or has been shown by you to be expanding with local parties. And dealing with schools and children, this is a vacation time for schools. Let's discuss the red if that's necessary after January 1st or 2nd when schools get back. But right now, schools are not necessarily an issue.
I'll second.
Okay, Tori seconded that.
Thank you. Quick comments.
Discussion?
Thank you. If I could, Marky?
Yeah.
Thank you. I guess the first thing I want to say here is that, these decisions aren't made based on restaurants making a majority of profit for their year. These decisions and considerations should be made upon whether or not these businesses are going to make it into the new year. I don't think anybody at 25% is in the same position they were a year ago, where they think that this holiday season is going to be able to buoy them through even the next few months, much less be a lion's share of their profits for their next year. This is survival. It's not a business decision here. This is a health and safety issue here. So I'm funny that Debbie just threw something up in the chat, which was my next question about aid and financial aid. Are we at any place that if we are going to prohibit businesses from being operational, that we're going to be able to get them any assistance? I don't know if Debbie has any more information on that, but that's one of the concerns that we have here is for health and safety. Two sides of this. One is those businesses which keep people employed, food on the table, housing over their heads, etc. That's a difficult ask right now. Number two, again, I go back to the safety concerns about a controlled environment. And I just want more discussion around that. I understand that saying let's go to a red, everybody stay at home, maybe a safest tactic for many people, but not all. This town is not closed down. I'm just concerned that we're using the blanket here when we should be more precise about what we're trying to accomplish in minimizing these transmissions. So yes, I did second for Dr. Kurt's motion, and I look forward to more discussion on it.
Okay, we have a motion on the table. We've had the second, now we're into discussion. Patty?
Thank you, Marky. Yeah, Tori kind of tapped on what I was going to say is you got to have the unintended consequences plan. If we start to really cramp down on business, especially with restaurants, it's not just a matter of the restaurant staying afloat, it's of all of their employees. Those are people that live and work in our valley, a lot of them in our community. And what do we do with them? They're not going to have health insurance. They're not going to have food on their table. They're not going to have utilities. It's going to be a really desperate situation. We're going to increase those child abuse, those domestic abuse, the drug and alcohol use. All of the unintended consequences need to be looked at. I'm not saying we don't need to tighten down. I'm just saying we need to really look at it carefully before we just slam the door and then go, oops, we have people now who are homeless. What are we going to do about that? We have to sustain a community here. And yes, we have to be protective of public health, but we need to sustain the community. We need to look at the broader picture. That being said, Marky, I bet somebody has this information about testing. Our numbers have gone up. What is the percentage of the tests? We have 5 sites now valley-wide, or at least in the Upper Valley. So I think it's great. We're getting people the opportunity to be tested. I know our percentage is down to 5.8 from the amount of testing versus positive. But yeah, when you ramp up testing, of course, you're going to see those numbers go up. And I think that's a good thing. And I think the traveler affidavit, we've had some people who were testing positive in their hometowns and thanked the staff for having that traveler affidavit because they were asymptomatic. And I think even if we catch 25, 50 people with that, that's a huge impact for our community. Those people would have come here and spread more of the virus from outside our community. So it'd be interesting we have to keep in mind, we're increasing the numbers. We're catching people who didn't have symptoms or had mild symptoms, and we're quarantining them or isolating them. And I think that's a positive thing. We need to really look at that, but we cannot just slam the door without looking at what we're doing before we lock it. So
Well,
thank
Patty,
you.
positivity rate is up into 7%. It's been as high as 9%, but the emphasis, if you do more testing, obviously you're going to pick up more people, but we're talking about the incidence rate is what's driving the community spread issue. And that's our focus for today. How can we get that incidence down? So our positivity rate yesterday, I think, was 7.4%. Kids, it was over 8%. So Jordana, did you have any comments on that?
I think, Marky, to your point, the indicator of concern right now is that incidence rate. I think what we're seeing is we have enough testing to be detecting the incidence in our community, and what we're seeing is it's astronomical and it's growing exponentially. So I think just to consider some of that whatever actions we take are going to take time to show any effect. And also the higher our instance rate when we take those actions, the longer it's going to take to turn that back around.
Okay, let's go back to, did I have anyone else who wanted to make a comment? Because Bill, go ahead.
Yeah, thanks, Marky. I just wanted to clarify, our incident rate is not super high coming out of restaurants. Is that correct?
That's a Jordana question, or a Josh.
Yeah, so Josh, if you're still here, I'll turn to you in a minute and just say that it's really difficult to track exactly how spread is occurring in a restaurant, in the patron side of things. What we are able to track is transmission from employee to employee. And Josh, maybe you can share the numbers, but I know that I think when we presented the data maybe on December 10th to the board, that the percentage of outbreaks that were occurring in the different sectors, that the restaurants had the highest percentage or number, Josh, correct me, of outbreaks occurring, meaning that there was transmission between, I believe most of the time it was employees in those settings. And I'll turn that over to our EPIs.
Yeah, Jordana, that's correct. So still the sector with the highest percentage of outbreaks is still restaurants. And again, to Jordana's point, it's really challenging to determine if patrons are being exposed at a restaurant or where they're being exposed. But 33% of our cases still don't have a known exposure source. So they're exposed somewhere out in the community. It's not within their household. It's somewhere in the community, whether it's at work or elsewhere. And they're not able to identify how they were exposed. I did want to add a few notes real quick while I have the floor. This is really partially a result of Thanksgiving, right? We tend to see a surge in cases following holidays. We are now about 3 weeks past Thanksgiving, which is when we expect to see a surge following the holiday. We do know about many Thanksgiving events that occurred during that week. And so we saw, a partial increase the week or two after Thanksgiving, and now we're starting to see more of a surge there as we see the growth turn exponential. And then the other thing I just wanted to point out is that, in the Midwest, cases begin to go down in Wisconsin, Illinois, Indiana. And what the officials there were attributing that to was that the virus was running out of victims. It had exposed so many people that it was no longer able to infect people because they'd already been infected. And my concern is that, we might be getting to a point here where, we just have so many people that end up being exposed or infected that we get to a point where the virus is like, well, I don't have anywhere else to go. I don't have anywhere else to move or people to infect. And then it sort of takes into question, a lot of the mitigation strategies that we put into effect the last 10 months. Because we protected people for 10 months and now they're being exposed either because they're letting their guard down or whatever else the reason might be, other mitigation strategies that aren't working. But my concern is that we've spent a lot of time protecting people and now we get to a point where they're now getting sick. And so, it's concerning. Eventually it may get into our assisted living center. It may begin to affect those who are more vulnerable. And it's concerning. And then the last point I'll make is right now the group of people that is most susceptible, the ones that are being infected at the highest rate right now are stay-at-home parents and nannies. Those are 29% of our recent cases. And half of them don't know how they were exposed. So what that tells me is that there is a lot of asymptomatic transmission occurring. And when we can't get a hold of that and identify how that spread is occurring, we've sort of lost control of being able to mitigate at that point. And from a tracing perspective, I think Brent may have brought this up. It's really challenging to contact trace when we can't identify where cases are occurring. So I just want to echo Dr. Levin's point that, right now we're at a point where it's a very critical juncture. And we have Christmas in a few days. We have New Year's coming up. We know that a lot of people are planning activities for that, even in the individuals that we're talking to when we do contact tracing. So I think right now is a very critical juncture moving forward.
Thank you, Josh. I'm going to look for comments and then I'm going to open for public comments. Greg?
Thank you. I just received some comments. My board appears to be kind of split on this, on the motion that's on the table. The comment I received was, how come there's no discussion about a curfew? We've had our chief medical officer just implored us to take this seriously and go into red. Jeannie, another doctor on our board, has said the same thing, that this is really serious and it's exponential. So I'm wondering, we're experiencing the post-Thanksgiving bump now. We're going to experience a post-Christmas bump in January then. And this it could be much more grave than it is now. So I guess I comes back around to the question that was just posed to me, is that why is there no discussion of a curfew in the town, so it's not just the restaurants who are bearing the biggest brunt of this over this holiday? So I just wanted to bring that forward so I can tell them I asked the question.
So Greg, can I confirm maybe or clarify the intent of the motion on the table? So the motion to go to red, except for restaurants, needs to be fleshed out a little bit more there. So we just heard from the executive director of CDPHE that they would not be supportive of us becoming less restrictive in our mitigation measures. One of those is, which includes the 10 p.m. curfew, 9:30 last call. So it would be I want to clarify, it would be my understanding that would be, that would still exist in this next iteration for us. So maybe, I don't know, Mark, if you want me to pause there and see if that is confirmed. And then I have another procedural question on what the thinking is around restaurants.
Greg, was that clear in terms of what Jordana said relative to curfew? That was my understanding.
Yeah, that was clear. Thank you about the restaurant curfew. The question I received, unfortunately, is a bit of an aside. And it's like, why isn't there a curfew for the entire community regarding, being on the streets? And like that's where that came. Or now I'm hearing businesses only, but I think you answered the question at hand. Thank you.
In fact, we might want to think about a Picken County-wide curfew. So thank you for bringing that up. We'll loop back to that one. I'm going to see if there's any other comments from board members. And if not, I'm going to open it to.
And then Marky, can I just understand procedural, more specifically, for us, if we say we're going to red, we would have to go to everything that is required within red. So if we're going to not fully be making a motion to do that, then what I hear is we're actually staying in orange and adopting some stricter some stricter protective measures, which are modeled off of the red level restrictions. Okay, so I see nodding there. That's what's being proposed, including the informal gathering size of 0, essentially only a household. And then I think I would just want clarification on the restaurant. I heard there being something about the 5-star program. So with the 5-star program for restaurants, they are required to have that 10-foot spacing and only be seating household members together. So I think that if there's discussion about whether one or both of those would also be required in our proposal for restaurants. I think that the household piece of this, in the messaging to the public and in practice, is really what makes red effective, is that you are only gathering with your household, no matter what kind of setting that is in.
Dr. Kurtz, since you put the motion on the table.
Not intend a 10-foot distancing in restaurants to apply. And if that's what exists in the 5-star program, I said we would look at the five-star program for advice, but not necessarily all of the components. And as Patty has pointed out, and I pointed out, restaurants in Aspen are not the gigantic restaurants in Denver that the people there are legislating this have in mind. We are a small town, and that is really very difficult to apply and keep restaurants open.
So you're trying to keep the footage at 6 feet like it is now? Tom?
That's correct.
Okay.
We're
Further,
here from Michael Goldberg.
when I open for public comment, then I'll take public comment. Other board members? Yes, Linda?
From observing everybody's comments and looking at the numbers, it seems that a lot of the young people are the people that are transmitting this, whether they have asymptomatic symptoms or symptomatic symptoms, or symptomatic, whatever. And it doesn't seem that that closing down everything is going to actually affect the people that are actually transmitting the virus. I was looking at the numbers, and it seems there were 31 cases of children since December 6th. And it goes along with the caretakers of children, and as far as moms and nannies transmitting the virus, average age, according to the statistics, although today that was different, but it says the average age since this all began is 36 years of age. These are the young parents that are getting together and inadvertently transmitting the virus. So I'm not sure if our focus is where it should be. That's my comment. Thank you.
Okay, let's loop back and finish up this restaurant conversation. Dr. Kurt is not in favor of the 10 feet. I'm going to ask balance of the board. I'm going to suggest his 6 foot is his proposal. And with that, I'll see if there's support from the board as we begin to work through the detail of each one of this. Members of the board that are voting members, could you raise your right hand if you're interested in maintaining the 6 feet? Tori is a yes. Tom, are you a yes or no? Yes. Anyone else? Nope, you only have 2 members that are supportive of a 6 foot. So the red would be the 10 feet.
I think,
Yeah, Britt?
this is a terrible decision because huge consequences either way. But, I could almost accept the 6 feet if we had other more stringent policies. Again, charging the caterers that you cannot cater anything that's, beyond whatever the required size is. And I personally am in favor of only having households. All of California is that way. In fact, there's no dining inside or out at the moment. And so to just do this one thing, that bothers me because everything tells me that we need to become more restrictive, either.
Okay. And with that said, then I was going to the next item. It was 10 feet and then only one household at any point in time. And the current curfew or call for the last drink maintains the same thing, and then the curfew remains the same. Is that what you're hearing, Jordana? Okay. Okay, now the other side of that coin is the catering businesses. And could you pull up the red on the catering business? It would still be a party of 1, right? Jordana?
So catering businesses is the question, what are they required? They would be required to follow indoor event guidance if they are catering in a private space. So I think if we're clarifying, if we're going to red, are we, if we're disallowing any indoor events to occur, then caterers would only be able to operate within, with a part like catering to only a household.
Okay, can you pull that slide back up, because that one little corner about indoor events? Well, there you go. I'm looking to the board.
So they would be permitted to have outdoor events.
Right. So let me clarify something. Jordana, for example, I know that there are some special things that the Jerome is doing, like Gingerbread House, and the Little Nell's doing something similar to that. All of those would be, they would have to be closed on the red level, right?
So, right, if that, if we are holding that restaurants are the only ones that are able to operate and not indoor events, then those kinds of events would be disallowed, while pulling out just restaurants.
And pulling out restaurants was the proposal and the motion that's on the table, and with those modifications.
Marky,
Yes.
can I get a clarification?
Yep.
It's my understanding, I think there's a lot of good things in the red zone that we could bring into the orange plus. The problem is, if you go to red, you can't be less lenient. You have to be as strict or stricter. When you have the orange, we have a little more flexibility to deal with our local issues, the things that we know the most about. So I think if anything, the board should support staying at the orange plus and bringing in some more restrictive things if the board so chooses to do that. But to go red, you're stuck there. You can't be more flexible. You can't say, okay, we're gonna do 50% seating in restaurants, but the red says you can't. But in orange, you can be more flexible, the orange plus. And I think we've done the best job. I'm very proud of some of the things we've done here, because we have looked at it as to what really works and impacts our local community. So I think the board should really, I can't vote, so I think the board should really consider that in doing the red, the orange plus, and bringing in, building it up with some of the things that the board supports out of the red. But you can't go the other way. You can't go to red and do anything that's not more restrictive. So I think we're tying our hands, and I don't think we're going to want to do that.
Thank you, Patty. So which is what we're talking about, is a orange plus plus, with bringing in the issue around the restaurant, which was Tom's motion. Now we're looking at the other items here, looking to see what other restrictive measures we can put forth. The indoor events and entertainment under red, as I just mentioned, those would all be closed. So
we currently have 7 event safety plans on file of folks who have submitted wanting to do an indoor event between now and the January 4th, I believe. And so those would then be disallowed.
How many was that, Jordana?
Only 7, which makes me think that most events that are happening are not submitting event safety plans.
I wonder if, I'm almost thinking we let the indoor events that have an approved safety plan occur, because all of those are between now and January the 4th. Any comments?
Do we have that right? I mean, is grandfathering even allowed? There's a concept?
Jordana? I would think it would be.
Yeah, we're an orange plus plus. We can make, as Patty stated, make the rules as long as they are stricter
Yeah,
than
as long as we stay in orange plus, yeah, right.
orange. Yep. And so the differentiation is those that have already submitted indoor event safety plans would be permitted, and some of those are outdoor events, so those would not be affected. One's a bar mitzvah, another is a dinner at a household. And those, so I'm hearing if you've submitted it and you've taken the efforts to do that, but then if you have not submitted an event safety plan now, we are saying no additional indoor events would be permitted to occur.
Let me ask you, did the
Could I speak?
the events happen? Let's talk about the.
Could I speak, please?
Oh, well, I guess go ahead.
I would like to withdraw my motion. I am withdrawing my motion because I can see a red is going to really fix this into a very inflexible program. Instead, I think the idea of an orange plus plus, as suggested by Patty and as Jordana said, could actually be implemented, would be the better alternative. So I make that as a motion.
Well, you have a motion that you have put forth. You had a second on it. And therefore, we need to vote on that motion. And if the motion, even though you want to withdraw, we have to vote on the first one, and then we have to have your motion to withdraw, which is fine. And then we have to vote on that.
And then we also have Jeannie's motion that was made after Tom's that we'll have to vote on. So yeah, we can wait till after that until you make this motion for an orange plus plus, Tom.
Jeannie's motion did not have a second, unless I missed it.
Jeannie, we didn't get to that point because we decided the decision, which is appropriate procedurally. Was to
Joey could withdraw his second for my motion.
I would support an orange plus plus, but I'm very concerned. This is a very difficult decision. I'm very concerned about this exponential growth. We have to be very careful. We could have an orange plus plus, but maybe people have to be careful. And if cases don't go down, we have to go into red in a week or two. So we have to have the carrot and the stick, because nothing is happening to improve the situation here. And it's quite dire. It's very serious.
Okay, we had Tom's motion on the table, which was to stay orange plus, or I'm sorry, to do red with exception for the restaurants. And there were who did the second one, made the second on that?
I did.
Okay. Are you willing to support? No, we have to do the motion. Let's vote on the motion, the original motion, which was Tom's original motion in terms of his strategy. All in support of that motion, raise your right hand. All opposed, raise your right hand. Okay, that motion has died. Now, next motion was to Jeannie. Did we have a second on Jeannie's motion to go all red? Yes, Greg? Greg has seconded that.
I'm going to second that.
Okay. Further discussion on Jeannie's motion.
And restate Jeannie's motion is to go all red, period?
Yes. Now, is that correct, Jeannie?
Yes, it is. I think we need to take some pretty hard action at this point, given the incidence rate.
Okay. So the motion is to go all red is Jeannie's motion. We have a second from Greg Postman. Further conversation.
And Marky, you had mentioned taking some public comment. I don't know if that's still the plan or not.
Yeah, I will do that. In fact, we'll do it right now. I don't see any discussion coming from the board. So let's open up the mics for public comment. And we're discussing going all red.
So Marky, would you like me to allow attendees to raise their hands and pick on them one-on-one to speak, or would you like to open up the comments box?
Let's do both. And public comment, 3 minutes max on any comment. And Suzuho, I'm going to need, or I don't know who all I have of staff who can help monitor this, because there's 89 people that are participating. Okay. And who do I have that would like to speak?
So I will let Kelly Curry speak next. I will unmute her.
Okay.
Hi there, can you all hear me? Great, I was sort of on the phone because I thought I had to call in too. Gosh, nice to see you all. You really have a difficult task in front of you, and I feel for you in this really trying time. You know, I think we made a decision in November. I think we hedged our bets about whether it was better to go into red then in order to save the holiday season or to put these mitigation measures into place. And it's hard to argue that they're working. So I'm really struggling to see any path forward that allows more opening up in our community. You know, I also have some conflict about whether the state is ever going to come in with a hammer. And I think this board has to be the board to decide what the threshold is and what our community should endure in this pandemic. How high the case incident number will climb. What is your max? How many is too many? You know, will we continue to rely on whether one or more of the other metrics move higher in the dial? I think those decisions really also have to rest with this board about what we're willing to see and absorb here. You know, you have a lot of power. The Board of Health has a lot of power endowed from the BOCC and the state of Colorado to make decisions. So I'm less focused on what color on the dial and more focused on the power of those decisions in the public health orders. You know, you can limit all activities to single households. You can shut down businesses that have outbreaks. You can pull licenses. You can require people to stop business if they're related to outbreaks or spreads of cases. You know, I have some hesitancy just in this moment regarding the restaurants. You know, I think we need to move into the red, but I have concerns about how we feed thousands of guests. I do think we need to keep that on the table for, you know, in the next week or coming weeks. And I think you should also consider decisions related to hotel capacity. It's hard to look at our resort as a whole and try and figure out how we feed people if our hotels are operating at 100%. And those are actions that you can put into place following January 1st or 2nd. You know, I think that there's requirements about HVAC upgrades. The BOCC has been willing to fund that to put into place for expanded capacities in the future when it might be important to do. And, you know, Orange Plus Plus does not have the strength of red when you try to message this to all of our community and people visiting our community. And I think that even though there are concerns about enforcement, and there are very real concerns, I think the assertion has to come from this board. And the strength of what the measures are has to be stated clearly from this board. You know, conversations about whether we move a curfew a half hour or whether we space tables 4 more feet apart, you know, these are a little bit like the Dutch boy putting his finger in the dam at this point. You know, I encourage us to move into the red, again, with just some concerns about what we need restaurants to do in our community to help feed people. And please consider that further. You know, again, as I said, I'm just one commissioner. This is my position. This obviously is not the position of the board. And I do recognize just the difficult task you have. I continue to offer to bring discussion to our board about how we mitigate families and businesses that are suffering through this pandemic. We figured it out at the onset. I think our community can come together to figure it out again as we head into the darkest days, which will be January, I believe. So thank you. Thinking of you all these holidays.
Thank you, Kelly. Thank you very much, Brent, for your comment. I just noted something else that came up, that we do not have 100% occupancy at all in any of our hotels. Okay.
Marky, we have Evan Marks who has raised their hand. Evan, I will allow you to talk.
Hi there, this is actually Janice Marks. I'm sitting here with Evan Marks, who is my husband. And I just wanted to say that, and I am a physician, that I think that Greg and Jeannie have made a very difficult recommendation. I've been following the Board of Health meetings through the entire pandemic. And in the last month, watching the numbers and the incidents rise so greatly and so quickly with our Orange Plus and trying to control the numbers, it just doesn't seem that it has worked. And closing restaurants obviously is a very difficult decision because livelihoods are dependent upon it. But I think that when the Board of Health looks at these numbers that are rising and hospital capacity and ICU capacity around the state getting tighter, we have to really take stock in our numbers in Pickton County and make the hard decisions to protect the public health.
Thank you very much. Do I have any other public comment? Michael, we'll turn on your mic here.
Thank you. It's clear that what we've done for the last number of months, including the time since Orange Plus, can be looked at as not having been successful. And to be clear, my goal at least is to, as I stated last week, to stay out of red. I'm not sure how we actually stay out of red when we do piecemeal changes. I'm going to speak. I'm going to speak on my behalf now, not on behalf of my representation of restaurants with ACRA. The business community came together, and one of the suggestions for Orange Plus was a full curfew. Frankly, I don't recall that we ever suggested a business-only curfew, because our view was, my view is, that a business-only curfew where you dump people back on the streets at 10 o'clock doesn't accomplish what has at other times and potentially still the greatest outbreak contributor, and that's private parties at homes. So if you continue your 10 o'clock, and I'm assuming I'm making this comment based on my understanding is that's what you're doing, is continuing the 10 o'clock at the state suggestion, then people really have nowhere to go except for homes. And we can't, nothing we're really doing, nothing you're really doing, it seems to me, even in red, because it just impacts really restaurants and gyms to predominantly, really doesn't impact where I believe that the most egregious actions are taking place, and that's in private events. And if you look around the country and look at the number of places that have put in curfews, Denver's a perfect example. They have a 10 o'clock curfew and their numbers have gone down dramatically. If I remember, Denver is 637 incidence level now, and they've been shut down, trying to get out now. But I'm just not sure how the piecemeal impact and closing restaurants alone without other tools to keep people from partying really affects what we're trying to affect, and that's public safety. Thank you.
Thank you, Michael. Other comments?
Marky, it doesn't look like we have any callers that have raised their hands, but we do have quite a few chats in the chat box. Do you want to go through them one by one?
Yes, go ahead. Take the lead there.
Alrighty. So from Allison Gish, what does all red mean for the ski operation? For contact tracing purposes, what is considered an exposure? 10 minutes, mask, no mask? Josh, maybe you can answer that, or Jordana?
I'll take the first one. So for the ski operations, they have a separate plan. So anything where their current guidance would be influenced, like restaurants. If we go to red, restaurants would not be able to operate indoors. It would just be takeout for the ski co, but they will continue to be able to operate and have their own plan for mitigating capacity with the different dial measures. And then Josh, if you're able to speak to a contact.
Yeah, for contact tracing, we've been using CDC guidance of 15 minutes. There are several different reasons or ways in which we might alter that a bit. So for example, if there are people carpooling and they're not masked, we have been using 10 minutes there just because we've seen that lead to a lot more cases. And then other types of indoor events where there's prolonged exposure and there's concern over the virus concentrating in the room due to airborne particles or airborne transmission. We have been at times quarantining whole rooms of people just depending on how long the exposure has been. But for the most part, we've been using the 15-minute 6-foot rule.
Okay. Next chat.
Please comment on how positivity rate has stayed below red level only due to asymptomatic testing at the Aspen School District.
So we know that when we do these large scale testing efforts in terms of using it as a screening tool instead of testing people who have been exposed or who have symptoms, that drives our positivity rate down. So we know that before we started having those large scale screening testing types of operations, our positivity rate was closer to 10% or higher. I can also answer this other question from Greg about what are the implications for the X Games. The X Games, because they are an outdoor event, have a contingency plan to be able to operate under the red levels by just decreasing the number of folks in one place at the same time. But they have that, knowing that might be a possibility, that because we had warned them that would have been a distinct possibility. Lindsay, I can keep going if that would be helpful.
Yeah, go ahead, Jordana, just work the way through.
Okay, a comment from Matt Lane is that I think the main issue right now is that people aren't taking this seriously. Going to red will make this feel very real for a lot of people. If we don't go into red this next week, we're going to be in a much more dire situation when we do after the Xmas and New Year holiday. Another comment from Jimmy Yeager. Tom's suggestion of Orange++ is most logical in regards to restaurants. It is a logistical impossibility to close restaurants on 12/21 when every restaurant has a full reservation book at 25% of our capacities. It will be impossible. We will do our part. We need guests spaced out throughout town. Ken Ramberg commented, the Aspen Daily News reported the Hispanic community in Pickens County makes up about 10% of the population. Yet at times since the COVID-19 outbreak began in March, the group has accounted for 40% of positive cases. Please comment. This speaks to the disproportionate impact of COVID on our Latinx and Hispanic population. Suzuho, I don't know if you are in a position where you're able to comment, but this has been a lot of the work that Suzuho's team has been working on. There they are. Thank you.
Perfect timing. Thanks, Jordana. Yeah, so I caught the tail end of that, sorry. But a lot of the work that we've been able to do through our Protect Our Neighbor grant has fortunately been in collaboration with members of our Hispanic Latinx community here throughout the Roaring Fork Valley. And we've really been able to try and increase our communications and really making sure that anything that we are putting out in English is also being developed in a culturally and linguistically appropriate way for our Hispanic Latinx community. So we know that we're working within system where our society has structures in place that unfortunately perpetuate inequities, but to the best of our ability, really trying to make sure that we are increasing access to testing, increasing access to information, and all of the pandemic response efforts to ensure that we're promoting equity in the best way that we can.
Thanks, Azuho. A comment from Matt Lane, most hotels are nowhere near 100% at the moment, and a confirmation from Debbie at ACRA that hotels are around 40% occupied. Let's see. Brent agreed with Kelly's statement, stating it was dead on. A comment from Robin. I've been silent since my husband spent a week on a ventilator with COVID last spring and was out of work for 2 months afterwards. I'm also a retired nurse practitioner with years of ICU ER experience. Please raise the level to red until the numbers come down. Vaccines are more available and our community is better protected. Numbers are soaring and town is full of people from COVID areas around the country. The virus is mutating and becoming more virulent. You have the opportunity to prevent further deaths and illnesses requiring ventilators, healthcare resources, personnel, and long-term disabilities. This is a critical week, and putting only monetary issues over public health and safety is a mistake. And a comment from Jimmy Yeager again. As far as restaurant outbreaks go, restaurants will always rank high as we have a multitude of locations with a high number of employees. In addition, an outbreak is a minimum of 2 people, and our 7 outbreaks is therefore a minimum of 14 individuals. Hotel outbreaks was 2, with 1 location being 20 individuals. So we need both numbers of number of outbreaks and the nominal numbers of individuals associated with those outbreaks. Marky, can you read my comments instead of me speaking? Debbie has posted a link for folks to occupancy reports. Allison Gish comments, will public transportation vehicle capacity change at all? That is not affected in the red level. Bill Tomsich has made a comment. Lindsay, I'll ask you to read that one here.
All right, I can go ahead and read that. Commissioner Postman made a really important point earlier about the need for cooperation from Eagle and Garfield counties. What is going to be done to prevent restaurants in Basalt, Elgibel, and Carbondale from getting crushed and potentially causing further spread in our neighboring counties? I feel the suggestion of Orange++ would avoid this very important unintended consequence of going to red right now.
Any other comments? I don't see anything else in the chat room.
We just received one last one, and then I can go ahead and close it if you'd like, Marky.
Okay, go ahead.
The last one, any update on New Year's Eve fireworks?
Marky, I can answer that, or Tori. There will not be fireworks. The city determined that the potential for gatherings, whether on the mountain, at private homes or in the parks, was just too much risk. And so we have canceled the fireworks. Tori, did I get that all? Anything to add? Okay,
I don't know if that's true in Snowmass, if they've canceled or not. I don't think so. Bill, we'll put that on your plate for consideration. Issue around fireworks. Okay. Okay, let's close the public comment section, and the hour is getting late, and we are going to be making some decisions. On the table is going to red. We have a motion, we have a second. I'll see if there's further conversation. Brett?
Hey, Marky.
Sorry, yeah, just a quick comment that, you know, as I think Kelly brought it up, you know, there's a lot of metrics out there and we have our charts and graphs and the wheel and so forth. But these are all constructs done by, you know, very smart people and very smart groups, but nonetheless, they're constructs. And they, in my view, they don't necessarily have to be completely controlling. The fact is, we know the numbers are working against us. Forgetting what the numbers are, we do not want to be on the sled that we're on right now. And so I just as that statement about maybe overvaluing these metrics, because to me, it's a matter of where they're going and trying to anticipate.
Right, it's the direction that is so
Right.
important to understand. Krista, I see
Thank
your
you.
face.
I was at work today, so I've been listening on my phone, and I'm sorry, I at lunch break, so I had a moment to participate, but I just wanted to say that I, unfortunately, in this situation, completely support Jeannie and Greg. I feel like our numbers are increasing in a way that's scaring me. I ended up speaking with my friend who is not only a Denver Health pulmonologist last night, but also on the governor's vaccination board over in Denver. They are having patients called from Texas. They said the newest patient they accepted, they had already called 26 other hospitals before they finally got to Denver Health, which was hospital number 27. So again, I think our decisions, unfortunately, like we think are a local control or a local issue, have far-reaching ramifications if we have to transfer patients other places. And he is actually talking with the CMO of CDPHE about also extending help to communities like ours, because I do agree with the commissioner that spoke in public comment, but I think this is really hard to pit community members against restaurants to have to come down on decisions like this. Thank you.
Markey?
Yes, yes, Patty.
Yeah, I still think that, first of all, did Tom Kurt's motion die or is it still out there?
We're on the second motion, which was Jeannie Seabold's.
Okay, so what did we do with Tom's? Did we vote on it? Did we pull
No,
it?
we didn't vote on it because we're taking these procedurally one after the other.
Okay, I just thought Tom's was first. I just wanted to know. But the thing to me is, I think we need to be, again, really careful. Since I can't vote, I'm going to put in my 45 cents here. And I think we have better control and we can do the better things for our community if we stay at Orange Plus. I know the numbers haven't shown it, but that means we can just tighten it up. I think if we go to red, we lose total control, and I think we will regret it. I think we're better off. We have smart people here in this community. I think we should keep it in Orange Plus, whatever you want to call it, and have some local control over the issue. And it doesn't mean we can't tighten, and I think we should tighten up some things, but I think we really have to look. I know we're protecting public health, but that includes mental health, includes social health, and it includes financial health. That's all part of the picture for this community. And I think we're going to be losing control. And if we go red, I personally think we'll regret it. I think going Orange Plus, tightening it up is but what we will do best here for this community.
Thank you for your comment. Okay, anyone else? So we have a motion on the table for us to go red. And Jordana, if we were to go, this is just a clarification and procedural question. What would the date be in terms of if we were to go red?
That could be up to the board. That would be an item for discussion.
Okay, so it'd be red, and then we would talk about the date. So the motion is to go red. Okay, so keep that in mind in terms of consideration of a date. Any other discussion? What's in the chat room? Hold on here. Okay. I think we need to consider that if we go red, we don't have control on whether we come out. That's true. Thank you, John. Yeah, Tori?
You're
Tori,
muted,
unmute
Tori.
yourself. Huh? Go, Tori? Tori? Can't hear him.
Or if you leave and rejoin, your audio should work.
Okay, John, did you have your hand up?
I just want to be sure my understanding, and Jordana, if you can maybe clarify this. So with the vote to go to red, that would be all of the red level restrictions. So there was some discussion about exceptions for restaurants and such over the holidays. So you're either going with all red level restrictions on this. If you want to do something in between, it would have to be another. I just want to be sure everyone's clear on what you're voting on. That's correct, Jordana?
That's correct, John. So the on the table is a move to red, the date to be determined. If we move to red, we accept all of the red level restrictions, and then we are in that red level until we have gotten our incidence rate and all of our metrics in the dial, those 3 different metrics, down into orange level for at least 2 weeks, and then we would be able to apply to move into the orange. We have gotten direction from the board that we'll pursue the 5-star program. So what we would be able to access earlier is if we have 2 weeks of sustained decline in our incidence rate, we would be able to have businesses that get certified in the 5-star program be able to be operating under those orange level restrictions while we are still in red. And so that would require the caveat that everyone saw about businesses operating, restaurants operating. If we did achieve that 2-week decrease, they were 5-star certified, they would still be required to have 10-foot spacing and only seat households while we were still in red until we got into the orange level.
Greg?
Yeah, thanks. Thank you, John, and thank you, Jordana, for articulating that and clarifying that. I would probably hesitate. I'm not going to withdraw my motion, my second Jeannie's motion, but I think I'd probably vote against going into red now, having heard that, and just whatever makes it easier. I don't think if I procedurally, if it's better if I withdraw, but I think that what I'm hearing now, and it's hard to make this decision, or it's hard to advocate for not tightening things up. So if we're going into orange plus, it's got to be with some restrictions that have some teeth. And the only reason I think I would go for orange plus now would be because it gives us more ability to move out when it appears to be safer.
Brent?
Yeah, I'm as tormented as Greg is. I feel exactly the same. I've retrenched my own position there, but I think something that really is super important is that whoever was it mentioned that the 26 hospitals that were looked at in order to place somebody. You know, if you get sick, you don't want to be in Aspen. At high altitude, we don't have respiratory specialists, et cetera, et cetera. And the fact that somebody had to go to 26 hospitals is an unbelievable statistic. So even if our data was even more favorable, the fact is you might as well be in an island off the coast of Africa, because if you get sick, it's going to be a horrific challenge to get you to adequate treatment. And in California, of course, they've got, my God, beds waiting everywhere. So I just want to say that however we vote, there are these other ancillary experiences, such as, again, 26 hospitals that need to be considered. We're in great jeopardy here in our little town. Thank you.
Just real quick, I think that patient was from Texas, just so you know.
That's correct.
Okay, I mean, fair enough, but it did take him 26, and these metrics change exponentially week by week. I mean, that is the fear, that if we knew that we could expect next week or 2 weeks from now similar data, that would be terrific. The fact is, everything seems to be moving forward exponentially, and that's the huge concern here. But anyway,
Just an FYI, I just looked at Andrew's report. Our incidence rate as of today is 1441. So any other comments? Because I'm going to call the question here shortly.
Marky, I'll go ahead and make a little discussion here real quickly. I have a split board as well for city council. While we are appreciative of wanting to strengthen restrictions, there's still some question from board members about specific movements related to restaurants. So I'm not going to support the full red, but we do look for more greater restrictions in an orange plus.
Okay, I think we've had enough discussion. Yeah, Tom, and this is my last comment. Okay, Tom.
I would like to echo Tori. I am certainly feeling like this is a kind of an Omaha Beach where we really have to go forward, but I am tormented about the fact that we're locked in for at least 2 weeks, that we don't have any under control. So I'm going to vote against this. That does not necessarily mean that I'm not for further restrictions.
Okay, thank you very much, Tom. I don't think any person on this call finds this to be an easy decision. This is one of the toughest decisions that each and all of us will ever make on behalf of our communities. So with that said, all in favor of moving into red, please raise your right hand. I have 1, 2, 3. Okay, all oppose, raise your right hand. Voting members of the board. 1, 2, 3, 4. Okay, that motion was defeated. Now I need another motion, which I think was part of your, Tom, an earlier motion was an orange plus plus.
That's correct. With definite points in the plus plus that we can monitor and get reports from Jordana and have an interaction so we don't have to wait for 2 weeks.
What I would like to really see is, no, I'm thinking the strategy, because we got the 2 weeks of the holidays, and we will define what those restrictions are. Right after the January 1st, we'll see what all the results are, and if we get interim reports, that'd be great, Tom. And then we have a board meeting to see how we did. What are we seeing in terms of the numbers? And be prepared and committed to go red if these interim strategies are not working over the holidays.
I agree.
Okay. Okay, so we have a motion on the table to look at kind of an orange plus plus, and then we'll work through the restrictions. And the period of time on those restrictions will be until like January the 4th. Does that seem fair? Okay, I have a motion on the table. And do I have a second?
Marky?
Yeah.
Greg asked for some clarification in this motion, just so I have an understanding of what we're being directed to do. So for the orange plus plus, I'm hearing that there is desire to include all of the red level restrictions, which would mean no indoor events. I know there was discussion earlier. I think that's a question for the board. Are indoor events who have already submitted a business safety plan permitted, or are we saying no to all indoor events? And then we would confirm that the 9:30 last call and 10 p.m. Closure of non-essential businesses would continue to exist, which is already in the orange plus plus. And then the last is for the restaurants. We would impose some additional restrictions, which I'm hearing there's I think there was not support for the 10-foot distancing, but that there was support for only households be seated together, which would also align with the personal gathering size of 0 and limiting that to households, which would also affect lodging.
Correct. That's my understanding of what we've covered so far. Any comments to Jordana's summary there?
I think it's the indoor event question of those that have already submitted an event safety plan. Does that matter, or are we, the board has the right to make the change at any point in time, but are they allowing indoor events that currently have a business safety plan to continue to operate, or is it closure of all indoor events?
I think we should allow them.
I think we should allow them because they've got a business safety plan in place. Tori?
Yeah, are these organized events at location, like public location, hotels and the like, or are they private house event safety plans? What's the nature of these requests?
They span the gamut. There's one at, I believe, a hotel. There's some at some private residences that allow for dinner type of gathering. And then there are some outdoors that would not be affected by the indoor. I can pull them up more, but I think that the surprise was that there were only 7 submitted in this next 2-week period, as opposed to, we know that there are probably many more that are being planned and have not gone through the channels of submitting an event safety plan.
Thank you. I have concern here. Some of what we saw in the fall season was some of the late season events, whether those were birthday parties or weddings, but get-togethers in general, that were filing business safety plans, and I believe even some of those had transmission or outbreaks, if you will. So I have a little concern around indoor events.
I think everybody is. Greg's hand. We'll just do a consensus vote here. Indoor events? No. All supportive of no indoor events, even though we've got a safety plan? Yeah, Greg? 1, 2, 3.
Would you restate that again, Marky?
Okay, the deal would be indoor events, even if they have filed a safety plan, they would not be allowed. Only outdoor events.
Marky?
Yeah.
I can't vote. I can't raise my hand, but I think your position is well made. These people have gone to the effort of doing the right thing, and we're going to slap them. I think if we just limit it to those 7 and then that's it, we draw the line. But they have followed the rules. They've done their safety plans. We know where those events are going to be. And you're absolutely right. There's going to be events all over the place that are not following the rules. I'd rather put my energies into getting those people up to compliancy rather than hurting the people who have done what we've asked them to do. And the other thing too, real quick, is I think the point that Ann Mullins made about the party companies like Premier, et cetera, we need to get them on board with this because they're just incentivizing, encouraging, and facilitating these events that are, going to be causing the problems. Thank you.
Mm-hmm. Okay, the indoor events that have a safety plan and has had it approved, all in support of letting them continue? 1, 2, 3, 4. We're fine with the ones that have submitted. And I will assume the events that are associated with the Jerome or Snowmass Village, I don't know if they have a safety plan. Most all of those are outside. So those should be okay. How about the cooking? Is it the cookie party or gingerbread over at the Jerome? Have they submitted a safety plan or are they required, Jordana?
Let's see, we've got Brian on the line here from our consumer protection team. Oh, I'm seeing they did submit they did submit a plan for that.
Yeah, that's correct, Jordana. We saw that plan come in a few days ago.
Okay, so those would be able to continue. Okay, is that enough clarification?
And then I think the final clarification there, Brian, you know, so there would be, are there events happening at, any event happening at a large kind of lodging space, would they be required to submit an event safety plan, or could they just be operating under their normal operations?
Generally, yeah, they would be needing to submit an event safety plan for any gathering that's going to be greater than the required limits that we currently have at 10, which will be now changed to 0.
Okay, so whatever we have received now, that those have been grandfathered in and no additional plans will be allowed to be approved.
Okay. Any other discussion on this motion? Greg?
Curfew keeps coming up. This is a wide-ranging community curfew. It's also includes a hotel occupancy cap. We're not going to hit 100%, but you know, as we saw in November, I just looked at the numbers. We had the best November ever, right, Debbie? What are we going to expect if all of a sudden our Christmas holiday and the hotels are at 100%? I'm just thinking that might be a recipe for, you know, disaster. As we're trying to limit these things. If we're going to allow a cookie party somewhere, it's like, I'm just not sure we're being very effective. So I think I need to crack down more, and I'd love to see discussion of a cap capacity limit on the hotels. And I'd like to see a discussion of curfew going forward for, you know, just so people realize this is a serious thing and it affects everyone. And I'm not sure how else to do it other than to make a very solid, strong decision here. So I'd love to propose that we add some language to this, but I'm open to hearing what people say.
Yeah, Greg, thank you very much. I was going to go right there to curfew, and this would be for all of Pickens County. What would be your proposal, Greg? 10 o'clock? And now look at John.
Well, I think it would have to match the restaurant curfew. Of course, it's complicated. It's hard to enforce. It's not fair. We know all these things, but it's something that we have to, we're going to have to do this. And there's always an exception why it's, you know, inequitable, but I think we have to do this where the virus doesn't discriminate. So maybe it's time that we get serious and make a pronouncement that gets everyone's attention. Thanks.
How about the rest of you on curfew? Any board member who wants to make a comment? Tori, can you pull off a 10 p.m. curfew there in Aspen?
Yeah, it's funny, Mark. You just took the questions right out of my mouth. When we talk about that, I guess I'd want to hear a little bit from John Peacock, and maybe that's a question that he would even throw over to enforcement. I really don't know.
Okay, I was going to call on Billy Manson if we could pull that off here in Snowmass if we needed to, and then John. Bill?
Well, I think it all comes down to enforcement. I mean, I kind of go back to the same theme. I really believe it goes to messaging. I think our traveler affidavit has gotten a lot of attention, and that's what we need to be pushing out to the community. We need to make sure the community understands what the expectation is, and that if we're going to say a 10 o'clock curfew, we're not going to have our police officers chasing people around the town. It has to be buy-in from the community.
Okay. John?
Yeah, so if the board were to give direction on this today, I would suggest that it be exploring. We would have to demonstrate the nexus between a curfew and reducing the infections, I think, for our attorney's office to sign off. And that nexus may very well be there, but Jordan, I don't know that we've done the specific research to create that versus, yeah, getting people out of enclosed spaces and mixing households and our 5 commitments to containment. You know, I hear the discussion about curfew. I just think we would need to really, in order for us to be able, if we have the enforcement capacity, actually legally be able to enforce it, we need to be able to demonstrate that a curfew of everyone is directly related to downturn in infections. And, you know, I don't know that we aren't, you know, curfew doesn't necessarily prevent folks from gathering in homes. It gets them off the streets. So we need to have that conversation.
Okay, thank you. So perhaps we would pick this conversation up at the next board meeting, and that would be about January 4th, when we begin to see the results of the holidays. Okay, is that reasonable, Jordana? Okay, Greg?
That was reasonable to me also. The other question that came up was, what are we doing in the way of outreach to party rentals, caterers, others, so they really get the message?
Okay, let's firstly, let's talk about hotel capacity, because that was number 2 on your list, Greg. Any proposals there? Because what I heard from Debbie, we're about a 40% capacity, or 40% right now occupancy. Now, of course, who knows what kind of snow we're going to get? Greg?
I just love to ask Debbie if we're 42%. Do we expect that through the holiday? And maybe that's not really an issue.
Hi, Greg, it's Debbie. I'm just looking at the report right now. We're hovering about 42% starting December 25th. We stay there. We're still at about 48% December 29th, but then by December 3rd, well, by January 2nd, it goes down 40, all the way down to 20-some% starting in January 8th. So it's going to peak on the 31st and the 1st.
At about 48%, maybe that could change in the last minute, depending on weather or snow or last minute bookings, but that's what you're looking at. Okay, yeah. So hotel capacity is already down 50%.
Yeah, I don't see that we need to tweak with that one right now. Okay, now there was the party rental catering. And you brought this up. Any suggestions here relative to catering companies and party rentals?
Yeah, I don't know. You know, I've worked so hard in communication, and the county's done a good job with it. Just communicating the new level of restrictions that's being put in place. I guess there's no, we get back to enforcement or fining, or there's no consequence if they don't listen, as far as I understand. And you can correct me if I'm wrong on that. As with so much other stuff during COVID, we're really counting on people to do the right thing. So just a heightened level of communication about these new restrictions to those groups.
And there are enforcement mechanisms in the public health order. And so, you know, we can issue, and John, correct me if I'm getting the terms mixed up there, but a notice of violation to a company who's violating the public health order. That goes to court, and there's up to a $5,000 fine or jail time that it would be determined by the courts as to what the penalty is for violating the public health order. I think the problem that we're seeing, the problem that we run up against, is that those take a long time to happen. And so, you know, the spread has happened by the time that we're able to levy any of these enforcement options.
But to clarify, then, a catering company or a rental company would need to show that they were part of the public health, the safety order that was put together for the event.
Right. So under what has been proposed today, the catering company or event would have to be one that has already had and it has already submitted an event safety plan.
Right.
And be approved, and then under those, and is abiding by what they've outlined, and then going forward, we are saying there are no indoor events permitted, so I don't know how you would operate as a catering company without an indoor, with no indoor events being permitted unless you were offering services to one household.
Okay, but your point is well taken. By the time there's some type of fine or violation, the event has probably happened and the spread has happened. So, yeah, thanks.
Okay, any other points on clarification or the issues around restrictive guidelines? Jordana, did we hit all of the high points that is part of moving forward with you issuing a new public health order? Just a minute, Tori, and Tori, I see your hand up. Go ahead, Jordana.
I've got an understanding, I believe, of the points that the board still needs to vote on this, right? But of what is being voted on.
The only other thing I had was the gyms at 10% versus 25%. Is that correct?
That's red, yep.
Okay, Tori?
Just a quick question. This might be for John Peacock. Do we have the ability to close down non-compliant businesses?
Yes, we have the ability through the public health order for violation of the public health order to order a shutdown. We have done that with at least one business. And then we have the notice of violation that Jordana was speaking to that allows us to pursue remedies through the court. Typically, when we do that type of close down, of course, we have to provide a path for reopening. There's not a whole lot in between, which I think is one of the enforcement challenges. You're either bringing your sledgehammer to the table or you're bringing basically a warning letter to the table. And so some gradient would be nice, but those aren't the tools we're working with right now. Now, the 5-star program in the future may give some of that middle ground by being able to pull the variances from individual businesses.
Because I strongly support it. I strongly support our ability to take the bad actors out of the game. So, as we move forward with this, the compliance question needs to be backed up with the enforcement answer.
Right.
So if there was the possibility of getting that kind of tool, a 48-hour shutdown, 72-hour shutdown to let these businesses know that this is immediate and it's there for us, I would support that.
Okay. I support that too, because we got to use the stick at this point. Okay. Jordan, are you all clear on all the restrictions that we put in place, or would you like Jordana to go through the final list before we take the vote? Let me know. Do you feel comfortable? Greg, what would you prefer?
I would love to hear it one more time. It never hurts. I'm taking notes.
And because we all got to take notes and talk with our folk that we represent in our community. Okay, Jordana, you've got the floor.
From the top. All right, so starting with the school level restrictions, I would suggest that we don't really include anything about the P through 12 schools because they're all suggestions, and schools have their own authority to dictate when in what modality they use. So I would start then let's see here, restaurants. So we are saying that restaurants are permitted to continue to operate at 25% capacity with a 9:30 p.m. Last call, 10 p.m. closure, and that all household, that they would only be able to seat households together. That's the restaurant measure. Group sports and camps would be limited to virtual or outdoors in groups of less than 10. Critical and non-critical retail remain at 50% capacity. Personal services is limited to 25% capacity or 25 people. Offices are limited to 10% capacity, and remote work is strongly encouraged. Bars remain closed. Gyms and fitness centers have 10% capacity with 10 people indoors per room or outdoors in groups of less than 10 with reservations required. Indoor events and entertainment are closed except for those that have submitted event safety plans as of, do we want to say today or yesterday? As of yesterday.
Probably yesterday.
Okay.
Of course,
So
yesterday was Sunday, so I'd almost move it to Monday.
Marcus, can you repeat that suggestion?
Since yesterday was Sunday, I would anticipate getting some plans in today.
Well, and I think that's the idea, is that we don't want to create a loophole here for folks to create more. We want to honor those that have already submitted what their plans are.
Okay,
for the week.
I see hands going up, heads shaking, so yes, we'll make it yesterday.
As of yesterday. Outdoor events and entertainment can continue at 25% capacity. Here's a question for the board. Our Orange Plus Plus has 60 people outdoors as a limit. The regular red has 75, so it would seem that we would keep that at the 60-person limit. I see a maybe head shaking.
Yeah, I'm a yes on that one.
Remain with Orange Plus levels there. Outdoor guided services are permitted to occur at 25% capacity or 10 people. And personal gathering size will be 0, with only permitted to gather with your household. Larissa, Kara, did I miss any?
I have a question.
Yeah.
Yeah, I hate to throw something totally new into the mix here, but you know me. We talked about single households going out to dinner together. We didn't talk about them non-single households staying in the same hotel room together.
I did, Patty, and
you did. I missed it.
So in personal gathering size is also carries over to lodging situations. So
okay,
we will update that in the traveler affidavit and in our communications out to lodges.
Okay, perfect. Thank you. Okay, I didn't create any more work for you. I feel much better.
That's going to create some challenges for our condominium and our and our homes. I can tell you that right now. Tori?
Yeah, I wanted to echo the same thing, Marky. A lot of this seems really difficult and really difficult to enforce as well. One household only, especially in restaurants and lodging and such. I just wanted to say that, this is really us pushing it as far as we can go without asking for a total shutdown, which is comes with its own problems and own health and safety issues. But, I think that we're definitely going to even hear a little bit of pushback on some of this, but this is what we need to be trying to do. Everything we can, outside of a total shutdown for the best health and safety. So I'm very supportive of this. I just want to say thank you to Jordana for putting this together so quickly over the weekend and also advocating for the tightest restrictions that she could get. And I respect that and I appreciate it. And I really hope that this is something that we all as community effort are going to be getting behind, I think it can be successful. As I've always said, I think if each one of us does our part, we can be successful through this. And that's my hope here. Thank you, guys.
Thank you, Tori. Any other comments? If not, I'm going to call the question on our Orange Plus Plus. So all in support of the Orange Plus Plus with the restrictions that Jordana and her team have laid out, raise your hand. I'm looking for the votes. 1, 2, 3, 4, 5, 6. Okay.
And is Linda still on? She's the other voting member.
Okay, I don't see her hand. Maybe that's because, okay, it's unanimous.
And Marky, I just want to clarify that strictly speaking, how we are going to operationalize this is we are in Orange, and these are the additional measures we're putting into place. Our comms folks have been communicating with me, and just want to be sure that we can communicate this out to the community as these are red level restrictions that we are moving to on the state dial. And I think that really speaks to some of the other concerns we had about being able to message this out. So just want to make sure that that is comfortable with the board so that we can accurately communicate this.
Okay.
Don't you think it's another way to use Pitkin Alert as a hyper alerting system that there's changes of, taking place?
Okay, yes. The effective date, Jordana?
I would suggest as soon as possible. We can work to get this written and become effective as of tomorrow.
Okay. Sooner than better, later. Okay, you have support from your board, unanimous to move this into an Orange Plus Plus. And with the understanding, and I'm adding this because we talked about it earlier, January 4th, if we do not show improvement, we're going to go red. That's what we talked about. Everybody there? That's a tough one, and we will revisit it, but let's really get that communication out there. You're probably all going to get phone calls. You're going to get emails.
Marky, I'd love to comment on that. Just that this is complicated enough and that we've made enough changes here that I'm certainly going to refer any media inquiries directly to Jordana. And then John, if they can't reach Jordana, through Tracy or however you're all doing it. But I think we need to be very focused on how this goes out, because I'm expecting the phone to start ringing, as you probably all should as well.
Yes. So yes, send all communications, please, to Jordana. Any questions that come forward from your constituents or your council members. This has been a very long meeting. It was scheduled for an hour and we've gone way over, which I promised Jordana I would not do. But I really enjoyed the dialogue. I enjoyed having everyone to participate. You've all done a phenomenal job. This is very difficult, but it's the right thing to do. So with that said,
thank you, Marky.
Do we have
Good
a
job.
motion to adjourn?
I'll move that, and just want to say thank you, Marky, for running a difficult meeting.
That was hard. Okay, thank you very much, Greg, for the compliments. All in support for adjournment?
Marky, I need a second.
Oh. I'll second.
Okay, bye-bye.
Bye.
Have a good evening.
Thank you, Marky. Thank you, Jordana.
Thank you. Have a good day, guys.